Hello, this is Dr. Stanley Lang with a few more coronavirus comments as things continue to evolve. Some of the things that are happening are getting into the news, some of them aren't, and you may or may not have been able to see this, but one of the things that has been sort of the official line that is told patients is that when you have symptoms that might be coronavirus, you're sort of triaged to go home and you're told that there's no treatment anyway. And so you only come back to the hospital if you're a lot sicker. Well, that has changed recently in that the President of the United States has approved chloroquine, which is an old anti-malarial drug from the 1940s. It's still being used, but it has been approved for use in coronavirus, not by the FDA, but approved for the FDA to do studies on it. So it's sort of fast-tracked approval. But there's a provision in the United States, at least, where if a drug has been approved for by the FDA for anything, then physicians are free to use that medicine for what are called off-label purposes. So many medicines in the United States are routinely used for purposes that don't match the label. And the reason that has happened over the years is because every time a drug company wants to expand the different reasons for a drug to be used, they have to prove to the FDA that it works for this new so-called indication. Well, if they can just get enough doctors using the drug for that other indication without ever proving it, then they save a whole lot of money, and then the drug gradually gets used for lots of other things that it was never brought to market for and never intended for. And there's many drugs that are used like that. So chloroquine technically does not need to be approved by the FDA for this purpose because it's already approved, and doctors are free to use their clinical judgment as to whether or not to try to use this medicine. Now, clearly, they don't like to go out on a limb to use a dangerous chemical for something that has a low chance of working, but this has been used quite a bit in other countries. France in particular, there's a virologist in France who has spoken publicly about his personal use of this drug, and his results are pretty astounding and definitely would qualify as an effective treatment. Now, a doctor reporting his results doesn't qualify as proof, but it does qualify as evidence. And so to say that there's no evidence out there would be incorrect, particularly when the doctor in question is a virologist, and so he's doing his specialty, and that's what this case is in France. So I want you to be aware that at this point in time, this medicine is being used in other parts of the world, and it is now officially being promoted through the President of the United States. So you don't have to have indications from the FDA to use it if you're a physician in the United States. And fairly rapidly, we're going to see lots of people using this. So you should be aware of that in case you get sick or somebody that you know. And the idea of staying at home till you're so sick that you need to be hospitalized, well, perhaps a strategy where we start treatment sooner so that I don't get sick enough to need to be hospitalized, maybe that's something that will evolve. I don't know where it's going to go. I just want you to be aware that this medicine is out there if you weren't aware of it. The second thing to be aware of was that there was research released today that showed that a very substantial percentage of people presented to the hospital with coronavirus, and their only symptoms were related to their stomach. They had either vomiting, diarrhea, or abdominal pain, or a combination of those, with no respiratory symptoms or very minimal respiratory symptoms. And a significant percentage of those people never even got respiratory symptoms. They just had the GI symptoms the whole time they were sick. Now, This is important because people are being told to pay attention for cough and chest pain and high fever, but they're not told to pay attention to symptoms that are related to the GI tract. There's another study being done in the United States that's estimating that about 10% of people are going to be presenting with gastrointestinal or stomach symptoms. So the study in China was 48%. So somewhere between 10 and 48% is probably where the number will sort out. But the point is, be aware that this is a symptom that might be the presenting symptom, and in this time of sort of heightened awareness, you need to be aware that you could actually have coronavirus, and more importantly, you could be spreading it to people that are a lot less able to withstand the infection, a lot more fragile than you are. A lot of people have mild stomach flu symptoms, and they just sort of pass it off. And well, it's not something to just pass off. I would encourage you to be not frightened, but wary and aware. So I hope you found this information helpful. I hope you stay well. God bless and have a good day.